I'd be happy to answer any questions, Steve, or anyone that. So, do we have a microphone that you can pass around? Oh, right here.
Can you say a few words about this, treatment for blood pressure and blood sugar level? Because the target seems to be moving yearly, depending upon consensus of physicians.
Yeah, you're absolutely right. There is a huge controversy within the world of cardiology and hypertension about what the optimal blood pressure target should be. And frankly, that has changed over the years. When I wrote Selling Sickness, I interviewed a cardiologist in North Carolina who told me, it used to be we would have patients coming in, their blood pressure would be 160 over 90. We'd say, yeah, it's slightly high. Don't worry about it. He said, now, if we were to do that, we would be accused of malpractice. Right? Because, if you're not treating someone who's got a blood pressure of 160 over 90 over 100, then, you're doing something wrong. As you know, with blood pressure, there are many non-drug things that you can do to reduce your blood pressure if you're worried about, affecting your diet, your exercise. There are other things that, as well, there are, I would say, a fair bit of overdiagnosis when it comes to high blood pressure, because the question is the machine reading it properly? Are you actually more nervous in the doctor's office and therefore have higher blood pressure than you would normally be? Don't laugh. There's a phenomena that they've studied. It's called white coat hypertension. And white coat means when you've got a doctor with a white coat and he's taking your blood pressure, you're in the presence of a professional who's looking after something very important for you, your health. Of course, your blood pressure is going to be slightly raised. And you drank 3 cups of coffee before you got to the doctor's office, so your bladder's kind of full. That'll raise your blood pressure. Maybe you ran to the doctor's office or ran up a flight of stairs. That'll affect your blood pressure. So this question of targets, I'd say that the best information on hypertension, if you're interested, is produced by the Cochrane Collaboration. So these are the people that I write about in this book. And so they look at all of the studies on hypertension, and most recently the Cochrane Hypertension Group has said that there is no benefit to lowering blood pressure from 140 down to 120, right? So even though major professional groups around the world are saying, normal blood pressure should be 120 over 80, something like that. Well, if your pressure's 140, then you need to be doing stuff. And they're not necessarily saying you need to be taking drugs, though that's kind of the hidden message, because a lot of times the lifestyle things you do aren't going to bring them down. But what happens is that many people are going to be put on 1 and maybe 2 and sometimes 3 antihypertensive drugs. So now you've got 3 drugs that you have to take every day to bring your pressure from 140 down to 120, when in fact there is no benefit in doing so. There's no statistical benefit that you're going to live longer and healthier at having a blood pressure of 140 versus having one at 120. The difference in the length and quality of your life is not going to change at all. So if you've got pressure 140 and everyone's telling you, you got to bring that down to 120, they are trying to turn you into a patient. They're trying to get you to worry about your blood pressure and possibly do things to change it. Now, those things that you should do anyways, like eat a good diet and exercise and don't smoke, and those sorts of things are important. Blood pressure is only one small component of your overall health, though. And I think that certainly in the elderly, when you're older, your blood pressure naturally rises. Your arteries become thinner and more brittle, and so it's normal to have a higher blood pressure when you're older. When I'm talking older, I mean 75, 80, 85. But what happens is that often physicians will say, well, you're 80 years old and your blood pressure is 150. We got to bring that down. When in fact, that might be perfectly normal or near normal for someone that age. And they're expecting to take this down to 120, the same blood pressure you had when you were 30 years old. So there is, I believe, a fair degree of disease mongering around blood pressure and a fair bit of overdiagnosis. And I would say, unless your blood pressure is to the moon, most people would benefit from just having altering their diet and changing their lifestyle to, if you're worried about your blood pressure. My mother's on a couple of blood pressure drugs, and I asked her, so what's your blood pressure? And she said, well, it's normal. So, well, why are you on these blood pressure drugs? And so when I went with her to the doctor to talk about this, the doctor said, but if she wasn't taking these drugs, her pressures would be a lot higher. And, as a son looking after his mother, I'm thinking, yeah, but what's the likelihood of her benefiting from taking these drugs to bring her pressures to the level that they are? And I know that there's very little benefit. At the same time, I can't challenge a doctor. I'm just an ordinary person, He's a doctor. She's a doctor, right? So, and other questions? I think right here and then here. I'd be happy to talk to you about a little bit more about that afterwards if you like, okay?
Hi. Thank you so much for speaking. It's so wonderful to hear all this information. The question I have is, you had said that you should see the doctor when you have symptoms. And then oftentimes when I've gone to the doctor, I get yelled at because I was told, and this is a pretty, holistic, very involved doctor who knows how to treat on, at different levels, not just, Western and medical. But I'm told, you're coming in only to see me when there's a problem. So I said, well, that's why I do come in. Well, you don't come in for your annual checkups, and you don't come in often to see me and get your blood drawn and all that. And she's a pretty, like I said, very intelligent woman, but what symptoms besides the obvious, like, black stools or pains or lumps, like what other symptoms? I mean, I'm not listening to her.
Yeah.
I do go in when I have a problem that I see, but what real symptoms do you think that we should be seeing a doctor for?
Well, broadly speaking, anything that you're worried about.
Well, if you're worried about everything, because they're telling you that you should come in and see me. You shouldn't wait till the last minute when, you have.
Yeah, I don't know what's going on there, and I would be appalled that a doctor would yell at me for not coming in when I'm perfectly healthy and have no reason to be there. If you have a good reason to go to the doctor in your own mind, I would say that's good enough. Don't avoid the doctor because you think you're going to be overdiagnosed. If you have something that concerns you and you think needs to be checked out, don't hesitate. And sometimes people do. My whole talk is about overdiagnosis, but there is problems of underdiagnosis as well. I mean, and I would say that they're sometimes as grave. You get some people who are just. A friend of mine who died very young with diabetes. He was a writer, a poet. He was a really big guy, though. He drove a Harley motorcycle, and he was a great writer. And clearly, he had signs of diabetes. We could all tell, right? He was thirsty all the time. He drank lots of Coke and other things, but and he clearly had signs of diabetes. He needed to go to the doctor, and he didn't. He didn't until one day he just died. I mean, he had clearly something that could have been prevented, could have been treated, and it's a tragedy that we didn't kind of force him to go and see the doctor. So I don't know if this is an easy answer to your question, but if you're worried about it, about anything related to your health or your son or your children or your parents, that you shouldn't hesitate. So do you want me to answer a question about colonoscopies? So I have a chapter in the book about colonoscopies. There's various ways to inspect your colon to see if there's signs of cancer. There's, we'll say, three major ways. The first one is what they call a fecal occult blood test, also known as the poop test, where they can inspect your stool to see if there are signs of blood in it, and if there are, you can get then you may be referred for a colonoscopy. Colonoscopy uses a thin, flexible tube that goes up into your colon, and it's got a little camera and a little optic sight, and it looks inside your colon. That's the second way that you can get sort of tested or screened for colon cancer. And the third way is a virtual colonoscopy, where they do a CT scan of your abdomen. And that is probably the least recommended, and some would argue the least helpful. It exposes you to a lot of radiation, results in a lot of incidentalomas, which means they're finding things that by the way, perhaps in other organs. So what I say in the book is about colonoscopies is that, in my opinion, the jury is still out on the benefits of screening with colonoscopy. So I'm not talking about, if you have any symptoms, again, let's be clear. If you have any symptoms related to your bowel movements or your colon, and you see blood, you should definitely go to your physician and ask for, some kind of diagnostic test to see what's going on there. The thing is, if you, this fecal occult blood test, there are some things that cause false positives. If you have a nice rare steak the night before, and you do the FIT test, guess what? They're going to discover blood in your stool. And so you shouldn't freak out because it's what you ate. It's not perhaps coming from you, it's coming from that steak that you ate the night before. Colonoscopy, I still think it's controversial. There are some who would argue that the benefits of colonoscopy is that once they're in there, is they can, if they discover polyps, they can remove them. Okay, polyps meaning a little, you know how sometimes you get these little loose bits of flesh that hang off various parts of your body? Well, you have those on the outside of your body. You also have them inside your intestines and in your colon as well. And so they can remove them. The question is, if they remove them, is that going to reduce your risk of developing colon cancer in the future? Well, some would argue yes, because those polyps are precancerous. They may be a sign that you're going to develop colon cancer somewhere in the future. That's what some people argue. Other people argue that, it's really invasive to go in there and clip off these little bits of skin that are hanging down, because when you do that, you actually may be making things worse. So there's that school of thought. They in Canada anyways, they say once you turn 50 years old, you should submit to the, every 2 or 3 years get this fecal occult blood test, and if it's positive, then you get a colonoscopy. Some people say, oh no, I need a colonoscopy right away, I'm going to go to the States and get it, because the cheap Canadian healthcare system won't pay for it. It's not quite true. If you have any symptoms and they think that there's a benefit of having a colonoscopy, they'll pay for it, and you'll get one for free. Yeah, so I think the jury is out on colonoscopy. In fact, when I was asked by journalists after this book came out, I did some media interviews, and journalists say, well, Mr. Castles, of all these screening tests you're talking about, breast cancer screening and prostate cancer screening and gene screening and mental health screening, of all those screening tests you talk about, which one would you do yourself? And I hate when they ask that, because and I said, and I had to think for a second, and I said, well, if I was a young woman and sexually active, I would consider the Pap test. That would be something I think has benefit. Yep. Though I said that 5 years ago, and I'm not sure if it's the same today. And I also said I'd probably consider a colonoscopy when I turn 50. I'm now 54. Never had it. Will I? I still think the jury's out. So no. Other questions? Right here, and then there. Okay.
Thank you. I'm a ripe old age of 75, by the way. It was funny to hear that I'm the oldest segment there. 2 weeks ago, I had I've been told that I needed teeth extracted, and there were 4 quadrants, and I asked to please be given lidocaine, because that was the only thing that I hadn't landed up in an oxygen mask for. Mm-hmm. And he said he was going to give me lidocaine. Then it turned out he gave me carbocaine, and I landed up in the oxygen mask with an arrhythmic heartbeat. And he said it's the same thing. I said, epinephrine I cannot have, because twice before I had already landed up with oxygen mask problem. Mm-hmm. So they did 7 extractions in one period and gave me carbocaine, and I felt my blood pressure going up. I asked what it was. They wouldn't tell me. Finally, I asked for a mirror, and I put the mirror up so that I could see it in the back. And it was already starting to go down, and it was the higher number was 245. What options? I've been looking for so long for a good dentist that I could rely on, and every time I land up with huge problems. And now I've had the extractions. I'm afraid to go back to him because he lied. He said he gave me a lower number when I asked him finally after the operation.
So can I just interrupt for a second?
Yeah.
I'm not sure why when I come here to speak, people ask me questions about dentistry. Because I'm really, I mean, even though talking about my own kids and orthodontics and that sort of thing is something that I personally experienced, I don't actually know the research in dentistry very well. So I actually don't know the benefits of lidocaine versus other things. And I'm not sure why you needed your teeth extracted, but I don't think I can help you there.
Okay, thank you. Sorry for the interruption.
Right here.
I just had a comment. A while back, I seen a documentary from Michael Moore. I thought it was very, very interesting. It's called Sicko, and I don't know if you've seen it or what, but he compared the Canadian healthcare with the United States, and then pharma, how much they cost here. A drug cost here, $175. You can go to Cuba and get it for $5 and all that stuff. And I just wanted to know if you had any comments, because I think that movie was that documentary was very, very interesting on that. I just want to know your comments.
Yeah, it was highly criticized by Canadians, by the way. I mean, when I say Canadians, because I work in healthcare research, and the Canadians that I know, the other health researchers say, Michael Moore was not completely fair about, the problems and difficulties in the Canadian healthcare system. I think it's superior to the U.S. in many ways, and mostly because whenever you get sick, you never have to worry about who's going to pay for it. I mean, I had a hip surgery 2 years ago, and man, I never saw a bill. Well, you do have to pay for the drugs, but that didn't really affect me because I told my wife not to stop at the pharmacy on the way back from the hospital. So it's a really good question. The issue of drug pricing, though, is something that I think is probably a national and an international scandal. Americans pay the highest drug prices in the world, also have the highest drug consumption in the world. The U.S. makes up about 5% of the world's population, but consumes something like 50% of the world's pharmaceuticals. In many ways, the U.S. consumer, I believe, is being ripped off because the pharmaceutical industry takes a lot of times government-funded research, turns that research into patented products that are increasingly more and more expensive, and then sells them back to the consumer, when in fact the basic science research was funded by you and I, the taxpayer. And so the consumer gets kind of screwed twice. That's a problem, and I mean, it happens in other countries. What we've got in Canada and other countries in the world is that we have negotiating power with the pharmaceutical industry. The pharma lobby is so powerful in the US, though, they have essentially prevented government from even negotiating prices. That is for the overall market. Though if you're a veteran and you're getting veterans benefits, then that is probably one of the best healthcare systems in the U.S. because they can negotiate prices. They can actually do what any shopper would do, is go and compare prices and get good value for their healthcare dollar. So if you had the Veterans Administration take over the entire healthcare system in the U.S., I think the overall population, the health of the population would rise, and the amount that you're wasting and spending and worrying about healthcare would drop considerably. It would be more like the Canadian system. Yeah. Any other questions? We've got the, right here, microphone here, please.
Hi, Lyme disease. Did not hear much, so obviously, recent years that obviously became a serious problem. And diagnose, treatment, and all of that.
Yeah. I can't speak knowledgeably about Lyme disease, except I know that it's very controversial. In Canada, apparently there's a certain test for Lyme disease that can help diagnose whether you have Lyme disease. Is a condition that's transmitted with by wood ticks, right? That you can, the controversy in Canada, anyways, around Lyme disease is the test is not paid for, right? And so if people want the test, they have to get this special test from the U.S. And when I've looked closely into it, this test that's in the reason why the Canadian healthcare system refuses to pay for the test is because they don't believe it's very accurate. They believe that it perhaps overdiagnoses Lyme disease or even underdiagnoses Lyme disease. So it's not specific or sensitive enough to diagnose the disease. Lyme disease is very controversial. There's, I would argue that you should read everything you can about Lyme disease if you're concerned about it, but don't believe everything that you read about Lyme disease, because some of it is probably not true. So, questions? Other questions? I've worn them down. Great.
One quick question. After seeing that the movie, if you had a choice, because the Canadian healthcare and possibly the United States healthcare, and that movie really described both of them in really good detail. And I was wondering if someone was sick, would where would it be a bit more beneficial to pay the high costs here in the United States or move to Canada if they were sick? I'm not sick, but if someone was, knowing the system, what would be your answer to that?
Yeah, it's a good question. I think healthcare dollars should come out of general revenues, tax revenues. We pay higher taxes in Canada. Okay, so if you're okay with paying higher taxes, income taxes mostly, than your friends in the United States, then the healthcare system in Canada is certainly more humane in my terms, just because there's no insurance companies. There's no competition for patients. You don't see ads for disease, well, other than cholesterol and other things, but you don't see drug ads. You're not bombarded with the market. And because the market sees you as a customer, and oftentimes you're a customer because, well, not because, you're a customer and you don't really have to pay for it because you have insurance, And one of my little chapters in my little pink book, I discussed this thing called job lock. Job lock meaning people are locked into their employment because their health care benefits are linked to their employment. This is something I learned when I was studying, and I thought, really? So you can't change jobs? Oh yeah, people in the U.S. change jobs all the time, but you have to, if you're jumping to another job, you have to think about what kind of health benefits come. If you got kids that need braces, for example, you have to think about all these. In Canada, you don't think about any of that. If you want a job in another province, you just get up and move. You don't think about what kind of health care that my new employer is going to get. So I try to think about what does it do to your psyche? And in many ways, this is the land of the free, but you're not that free if you can't move out of a terrible job into a better job if you're going to get worse health care, because that's really important, that your health insurance. So it really, I don't think it's very humane that you get stuck in situations, in employment situations, and maybe even some nasty situations, but you can't move because of the nature of the way the healthcare market works here. So, and by the way, the United States is an outlier, right? So when you take the 22 OECD countries, France, Germany, Belgium, Canada, US, Australia, you take all those countries and you look at sort of the way healthcare is delivered, most countries have a mix of public and private, right? Including the U.S. There's public health care in the U.S. if you're a veteran and if you're on Medicaid and Medicare, those are public. But most countries, the public size of it is much bigger and the private's like this. Whereas in the U.S., it's the opposite. The private is this big and the public is a portion of that. So the U.S. is much different than, I would say, every other country in the world when it comes to delivering health care.